So the page you're looking at right now, this is IconNotes. This is basically the homepage for IconNotes. It's called the chart room. It'll say chart room 4, have the clinician's name here, working at, and it'll have the location or site that this particular person is working at. Now, if you have the different programs, you can actually click here and say where you're working at that day. So if you're working in an outpatient setting, you have that. If you're working inpatient or IOP or PHP, you can actually enter those different settings into your group account and then select where you're working at that day. And that will put the correct letterhead and billing information on your document, so you can also track like where that person is. If that person is in a specific level of care and you want to, no matter what site that this clinician has here, and you want it to default to that, whatever is assigned to that particular patient, you can do that too. You have file cabinets on the left where you can access the records. They're in alphabetical order by last name, or you can use a search field here in the center. It's not case sensitive. You don't need any punctuation. You can actually just type in a piece of the name. So if I'm looking for Jessica Jones, I can type Jess J, keep it really simple. You can also search just by people that are assigned to that one location. There's a working at site only option. So I only want to see people that are assigned to the psychiatric hospital site. So I can click A through C, and then that's the one person in the A through C. If I want to see just the people at the psychiatric clinic, you can see it increases there automatically. If I just want to see the people assigned to me, I can do that as well. And just if you're the principal provider, you can see how the list shortens. Now, before we actually go into a record, I just want to show you some of the details here on the right-hand side. These are other file cabinets that perform other functions within the program. Here you have make a new chart. That's where you can add a new person into the system. You have a calendar for the scheduling. You have an MAR for your medication administration record, and there's a schedule feature, which I'll demonstrate in just a moment. We also have therapy groups. So if you're inpatient, you probably do a lot of therapy groups. This is where you can create a group, put people in a group, create a note, and push that note to all the charts. You can individualize each of those notes as well. Then you have your messaging center. That's what you can use for internal communications within the program, and also for receiving reminders. So if you have set any reminders in the program for yourself, this is where they'll go. You have your patient accounts as the financial side, and then you have settings and directories, and that's where you configure everything when you first get started. So what we're going to do here is we're just going to make a new chart and kind of go from start to finish. So what I'm doing is I'm going to click make a new chart. I'm going to put in a first name, last name, date of birth. There's Tom Jones, and I'll put in his date of birth. All right, and then we're going to click continue. Now the program's going to go through and make sure there's nobody else with a similar name or date of birth. If there is, it'll pop up and give you a warning. If not, it'll bring you right here to the screen. Right now we're in the new patient demographics, and you'll see some fields here where they're actually pink or red. These are required fields. You have to have these fields filled in order to save this as a chart. You can include other fields in here, like if you're using the program for billing, there's a button down here at the very bottom called the show button. When you click that, it actually highlights all the fields that you need for billing in yellow. Okay. So what I'm going to do is I'm just doing a quick little telephone intake, just trying to get some information about this person. I'm actually going to generate an ID number there for them and then select the gender. He's a man. And you can fill in other information like what's his address, does he have a zip code, what is the phone number. If they don't have a home number, you can put a cell number. That's not a problem. All right, and I can also put in insurance information. There's a new button there to add in the insurance, and you can put in the policy number and those kind of details. But what I really want to point your attention to is down here to the admission notes, because you want to get a little detail about, hey, what brings them to this facility. So you can click admission notes, and we actually have what we call admission notes shrub. This shrub is a quick way for you to document the details and make sure that you're asking the questions that you need to when you're getting the information from them over the phone. Basically, you're going to click on this item in the first column. It's going to branch out into the second and possibly into the third column. And as it branches out and you make your selections, it's actually going to pop that detail here into your note, into your little telephone intake screen. So here, maybe they have some compulsive behaviors, maybe they're restless, some spending binges. Here they have some, other things, maybe deterioration of hygiene, decreased ability to parent, so on and so forth. Okay, so as you're clicking on these items, there may be some withdrawal signs, and you can type into this field, this yellow field. If you were to click something, let's just say I clicked this a few times and I didn't mean to, you can always highlight it and take it out. You can right click, cut, copy, paste. This center feels just like a Word, similar to a Word document where you can free text in there. So here, maybe they have some yawning, sneezing, and we'll just say diarrhea. Okay. All right. So there may be some things in there that they're just expressing and then they want to get some help for that. Now, if you don't see what you need on the left-hand side, or you ask other questions that perhaps you don't see in this list, you can come to the right-hand side and create a custom button. If you wanted to be more specific about the chemical withdrawal that, that they're experiencing, like, hey, what is the chemical? You can actually create a custom button. Give that button a name. And then here in this very first box, you can type in chemical and then just put opiate. You can make this say whatever you want it to say. You can put it in a sentence. You can make a list of the different chemicals, opiates, benzos, alcohol, so on and so forth, cocaine, marijuana, whatever it is that they may be on or that you specialize in. So you can enter a list of those in there if you want to. Right now, I'm just going to put this one, and I'm actually going to click continue to save that button. Before I do, you can share this button with other staff members. You can also share it with the whole group instead of having to click everybody's name. Okay. Now, what I'm going to do is I'm just going to click continue. So if you work with a lot of people who the chemical that they use are the opiates, you can actually just click that button now, and it'll pop that right into your note. Okay. Then from there, you can just continue on. It stays highlighted on the left-hand side so you don't lose your place, and you just click through. Yeah, well, not pregnant. I'm pretty sure that's not something for him. So if that doesn't apply, you can always skip it. Substance abuse, yes. Substance use. Here, I can even move this around if I wanted to. It's really easy to adjust the information in here to however you need it. Does he have suicidal ideations? No. Is he a danger to self or others? No. Is there an immediate threat? Yes. Brief intervention needed. Or, and what is the status? Referred for remission. Okay, so as you're clicking on these items, again, it's just populating right there into the note for you. You can click your back button to go back to your telephone intake. Okay, and then there it is. And this telephone intake screening is just going to stay here in these new patient demographics. You can print out this telephone screening at any point. It'll include this detail along with who called and their insurance information, the details that you captured right here. I'm just going to click new and add an insurance, hopefully one that pays really good for inpatient and outpatient. There you go. There you go. And you can put self, spouse, child, or other so you know who's carrying the insurance. And the more details you get in, the easier it'll be to populate. So what I'm going to do right now is I'm actually going to pop over here to my episodes of care because maybe this person hasn't been admitted yet or they're going to be admitted. You can actually put in, when they said that this first occurred and have they have a similar illness like this before. You can document that if they've ever been in treatment previously. And any other information that you have available. Well, he's not admitted yet, so he just called to pursue help. So he's going to be coming in today. So what I'm going to do is I'm actually going to save this. There's a save button, okay? And I'm going to assign myself as the provider. All right, and then this is what the chart looks like. Now, sometimes when people come in or they call, let's just say they call and they don't come in, you can actually mark their chart as pending since they're not truly admitted just yet. There's a pending option right there that you can select. And what that will do is it'll just put it in a pending status and it'll take it out of the active charts being that they haven't truly been admitted yet. And once they are admitted, you can easily change that there, or when you click back on the demographics tab in the upper left-hand corner and you go to admit them or to get whatever additional details that you need. There you go. Here, he's married or single, and any other details that you want to put in here. There you go. You can also come down here and put the location. We're actually going to put him in the hospital. There we go. And we're going to make his chart active and click on episodes of care. On this episode of care, this is, like I said, where you can mark them as admitted. You can put in that legal status. Is it voluntary, involuntary? What's the admitting diagnosis? Whatever details that you need to put in here. All right, you can just click on that, add that hospitalization date. Now this is just one way to do it. You could put it in there manually, but I'm going to click continue and just come out of here. We also have a field here at the top specific to inpatient residential where you can mark the arrival time by clicking the set button, and then whenever they discharge, click the set button, and it will automatically put in the day and time that's current. All right. Now, something that I didn't say before is that you can assign multiple providers to this chart. And based on whatever roles they have, so if you have one for nursing, one for the psych MD, one for the med MD, one for the therapist, so on and so forth, that it'll actually send them reminders to do their documentation on whatever time frame that you have set. Usually most nursing assessments are like due within 8 hours of admission. The psych MD and med MD need to do their HMPs and their psych evals within 24 hours of admission. And the therapists, I think they have like 72 hours. But, you know, it can vary from location to location. So what I'm going to do is I'm going to go back in the demographics. I do love the demographics, so you see me coming here a lot. There's my information. I'm actually going to put myself as a psych MD. All right, and then I could select other multiple clinicians that are going to be assigned to this record. So here I'm going to put in, here's Nurse Morris as the RN. I'm going to put here Miss Janina as the therapist, and I might put Dr. Rogers here as my MD, my med MD, and I'm going to click done. Okay, when I'm going to assign those providers, and then here I'm going to assign their roles. This is RN. This is MD. And then this here is my SW. Okay. All right. And then I'll click continue. And when I do come back and I click that set button, that's when it's going to send me those different clinician reminders. Okay. So when I click continue, it tells me how many reminders it's created. So all of these people now know that they have some work to do and they're on a time frame. Now those alerts are actually coming in here to their clinician reminder sheet, and they'll see that when they first log in. If you'll look on mine, I actually have one for Tom Jones right here that I need to do the psych eval, and I have until this day and time to complete it. Above that, you'll see Miss Porter there that I am way overdue, so it's made it pink to let me know that I should have had that done a long time ago. Hopefully you don't have too much of that. I can also see I need to do a follow-up treatment plan here in May, so I got a little while for that part. Hopefully she's not still here in inpatient, but she might be on outpatient. Okay, awesome. So that's just a cool little thing that we have just to help people, you know, use that as like a taskmaster to make sure that they reach that. Now I'll get to the actual, to the assessments down here at the very bottom. Depending on what stage they are to their admission, you have a pre-admission assessment, a chemical dependency assessment, and a complete assessment. If they haven't been admitted yet, you just want to make sure they meet the criteria. You have that pre-admission assessment that you can click through. If they're here just for the chemical dependency, there's a chemical dependency assessment. It covers the 6 ASAM dimensions, and you also have a complete assessment, which is more of like for your psychiatric evaluation that includes other stuff than just chemical dependency. So if it's a dual diagnosis or co-occurring diagnoses, that you can actually populate details about all of that there in the complete assessment. For this one, I'm just going to click chemical dependency so you can see what it looks like. In this section, you can, you have tabs here across the top. And basically what you're going to do is you're going to work left to right through the tabs and then just top to bottom through the columns, choosing what's relevant to this person. Now on the chemical dependency assessment, you can click on our buttons. This is just going to get some more supportive documentation as to why you chose the risk rating that you did. So if I choose the chemical use history, I can click on that. It brings me to the chemical dependency shrub, again, like a bush or a tree. And you click on an item in the first column, again, it branches out into the second and possibly into the third. And as you're clicking on these items, it's populating that text in there for you. And again, you can always right click, cut it out if you need to, or delete. And then you just gravitate back to the previous column. Here's the drug use. We're just getting some more details. It's opioids. They are taken in larger amounts, failure to fulfill obligations, tolerance has occurred, it has a diminished effect, withdrawal has occurred, they use to avoid withdrawal, and the depression, I'm going to say, is pretty severe. And then here you can go more specific as to the type of opioid that they're using. Okay, it's truly like OxyContin. I'll say that that's what they're using. All right. Awesome. And then you just gravitate on back and just put in the details as they're available to you. Unable to identify trigger, here the amount used. Maybe they're taking so many pills. I'll say like 10 pills a day. Whew. All right. And then you can actually put in 10. I might even write this out, 10 80 milligram pills per day. All right. And then you just continue on route of administration. Let's just say they snort the medications, and then here's the frequency. It's continuous, daily, trouble stopping use of substance they can't stop, and the longest period of abstinence has been, here we'll say 1 day. All right. And then just continue on. Length of use, this has been for months. Let's just say 5 months. And then the last use was 3/6/2018. All right. Cravings are reported and withdrawal is likely. And if they've used any other medications or drugs, that you can document those. For now, I'm just going to click the back button to go back, which, by the way, the program saves automatically every keystroke. So you don't have to worry about clicking a save button in this particular type of document. Okay. That's with all of our notes, our clinical notes, it saves automatically. So here you go. You continue on. You can put in the withdrawal history. You can do a CWA if you'd like, if that's related to alcohol. This one's not. So what I'm actually going to do is I'm going to come over here and I'm going to choose on my risk rating. So I'm going to say it's probably a 3. And it's going to pop in that dimension, that risk rating there, and then give a description of what that risk rating means. And then you can just move on to the next tab. And you'll also notice there are custom buttons on the right-hand side as well. So if you need to add any additional detail, you can. Here I'm going to say that they have difficulty tolerating coping with physical problems as well. And you can put more detail in here. If you want to do your risk rating first and then do your documentation, you can do that too. It just depends on how you want to set that up for your own particular practice or facility. Okay. And the rest of these work very similarly. They have shrub options. You pass psychotropic meds. Have they ever been prescribed anything? He's like, yes, I was prescribed, let's say Lexapro. And it was stopped because it had side effects. Okay. And then you continue on. Any non-psychotropics? He says, no, I'm not on any other medications. And then there's a medical screen here where you can document like do they have any infection or disease, TB, so on and so forth. Okay. All right. And then just click your back button. Continue on. All right. Now, as I'm going through the tabs, I'm just going to populate some of this other detail, just some risk ratings really quickly so that you can see how that works, because I really want to get to the medication part. All right. And then here's your recommendation. All right. Up here, you can put in the diagnosis. All right. In the diagnosis part, we do have DSM and ICD-10. I know some inpatient facilities still like to use the 5 axes, even though DSM just eliminated those. We do have that available if you wanted to use that instead. But for here, we do have an ICD-10 short list just for your principal admitting diagnosis. So I don't think I have mine in my short list. Yeah, I don't have mine in my short list. So if you know the code, you can type it in, or if you want to use your DSM, you can do that too. Now, if you do know the code, just type it in and it'll look it up for you. There it is. Here's DSM. If you want to click in this first column, then you can go through to your substance. What we do is we have drop downs, and whenever you select a drop down, it'll activate another one until you get as far as you can with your diagnoses. Here you go. Now, when you're done with DSM, you can convert to ICD-10 because ICD-10 pays the bills. You can also reorganize these. So I've put in opioid dependence, uncomplicated, and then down here is opioid dependence with withdrawal. Well, if I wanted to reorganize these, I could put 1 in the order 2 here, and then it'll reorganize these. Or what if I put this in incorrectly and I want to remove it? There's a red X over here. You can remove that. Okay, and then you can put anything else that's going on if they have any other kind of medical issues or any kind of psychosocial circumstances that you want to document. For now, I'm just going to hit done. Okay, then I can come down here to my recommendation. I can put in a summary or what I recommend for them. So I'm definitely thinking this person needs some inpatient. You can insert risk ratings. You can insert your assessment summary, you can also come over here to the right-hand side, and we have buttons that you can click that, hey, this person, they need some detox. All right. And it just presets that for you, so you can pop that around in there. You can even put in your billing code if you think, whatever it is that you're going to be billing for that service. Okay. All right, now that's just for that initial assessment. You could do your start and end time. You can scroll down and compile this note. Now, if I'm a clinician, like if I'm a psychiatrist, I'm going to be just go ahead and do the complete assessment and then go ahead and put them on their detox protocol, which I'll show you in just a moment. Just so you can see what this little dependency assessment looks like, it'll have the name and letterhead here at the top. Now, I do have my default set to the psych clinic. You can adjust that here on the right hand side if you forget to change it originally. So there you go. There's your details there. There's the date and time, and you can scroll through and see the information for that CD assessment. All right. There's all the dimensions in there. It's got your details below. If you put in a code incorrectly or you didn't mean to, you can always just highlight and delete those out. Okay. Now, of course, we want to spell check this 2018. Make sure you spell check that, and then you can sign electronically just to show that you're done with that part. Right. If you need to print this out, you can. If not, you can always go back to the chart room or to the chart piece to see how that note pulls into your chart itself. So here's my assessment. That's my CD assessment. There's the date, my initials. I can see that I've signed it. This is the type of assessment. This is where they're seen. I can still see my admission date at the top. And if I want to view this note, I can click compile note. If I made a mistake and I need to go back into it, I can click on the work areas and go back in and correct those. Just make sure that you recompile it and re-sign it. You can see your diagnosis over here to the left. And now I'm actually going to go into the complete assessment so that you can see what that looks like. We also have the 6 ASAM dimensions within the complete assessment as well. So if you want to do like the all-powerful assessment, this is the one you want to go to. So this one works very similarly. You have your tabs here across the top, and then you're just going to work top to bottom through the columns, choosing what's relevant to this person again. So here the program knows I already need an identifying sentence. Mr. Jones is a single biracial American 37-year-old man. His chief complaint is trying to get off the pills. Okay. And then again, you can come over here to the left-hand side and you can put in some of this information. There's the chemical dependency, so on and so forth. I'm not going to go through that part again, but just so you can see what it looks like. And there's a little red X just to let you know where you've been. Okay, then you can move on down. And I was telling you about the ASAM, the 6 dimensions are in here. They're down here below on the Do a ASAM screen. So if you did that and you wanted to have that populate into your note, you can. It's not that you actually have to go through this whole thing multiple times. Okay. All right. I'm actually going to take that out. All right. And then as you're going through, you can say like whatever your medical decision making is. You can say your problem partner review of systems, your other systems for your medical systems. So if they're normal, we do have normal buttons that you can click. If you need to see a detailed ROS, we have that here as well. Okay, and there's shrub options like everything else. And then you can continue on through the rest of the tabs. There you can see it's put in the risk ratings in here into the various fields for me that I have filled out in the chemical dependency assessment. All right, so you see some of that information. It's not like you have to do it all from scratch. It's going to be right here in the program. Okay, there's your social history, developmental history, family history. Here I'll say this person's never had any family history. The mental status exam. It's very easy. You're just clicking through buttons, column through column. There you go. You can come down here, do a physical exam, do the aims. If I were the person doing the history and physical, the H&P, then I would do my history of present illness. I would probably do my medical history, and then I would come to the mental status exam and do the physical exam down below. They wouldn't necessarily have to go through all those other tabs if it's not relevant. All right, so I'm going to say this person's guarded, mentally communicative, disheveled, and unhappy. Speech and language are normal, but maybe they're just a little bit depressed. Normal affect, not psychotic, not suicidal, not homicidal. I'm going to say they seem to be well-oriented. You can document IQ, is insight fair, judgment's poor, has signs of anxiety, they're very fidgety, has poor eye contact, and there are signs of withdrawal. You can see lists next to that, and it'll have the different signs, maybe some anxiety, agitation, diuresis. GI disturbance, muscle twitching, yawning, so on and so forth. If there are any signs of intoxication, you can document that, or any delirium tremors, any DTs. Otherwise, just click the back button. Remember, this is still saving every keystroke. So here on the finish initial part, when you're in this particular section, you can enter, this is where you're going to enter in the actual clinical orders. Okay, so for the medication, you can just click the enter button. All right. And you're going to have your standard medication list. The medications have to be entered on the standard medication list in order for them to appear on the MAR. Okay. So if you have standard protocols that you use, you can actually set those up in our system. And then way over here to the right, I have my screen zoomed in, so it's kind of big. You have those different protocols that you can select. So if you have an opioid detox taper, you can just click that. And whatever you have in your taper will populate here into these fields, so that will save you multiple selections and a lot of time for doing that part. If you have, the informed consent for those, you can mark that consent and say here, this was given by the patient, parents, mother, so on and so forth, and then hit done. There you go. So you have consent for that taper. If there's any other protocols, like a lot of people do the PRN protocols, you can set those up as well. They're very quick and easy. You can just pop those in there right there on top of it. Okay. All right. And then, of course, I just get consent for everything. I know you really only need it for your psychotropics in most cases, but me, I just like to get it for everything so they know what they're taking. All right, awesome. Okay, so what we're going to do here, I'm just going to take this part out. You can make any adjustments on the screen that you need to. You can print this list out if you'd like. For me, what I'm going to do is I'm actually going to click done. Okay. All right. So when I do, it'll show a list of the medications there. I can also order other labs and things like that from here. It doesn't send those lab orders electronically, but it does have your admission orders and things like that, like here, let's admit to the detox unit, conditions, so on and so forth. There you have your routine labs. I like to do my lab orders through here, through the lab and imaging. So here you can have lab protocols for your lab orders too. Okay, so there's my lab orders. I can put in my instructions. If I have any instructions, it'll pull in the person's name and their insurance number and their diagnosis and who the ordering clinician is. I can change my site here if I want. I can change this order, the name on the order, if it wasn't truly me, or if I'm doing a verbal order for someone else. You can print this out, send that to the lab if you want to, or you can just click the back button. What it will do is it'll put all these orders in here, your admission orders, your medication orders, your lab orders. It'll have all of that onto your clinical order sheet. If you have any other orders, if you need a dietary referral or anything like that, these are all going to be there. You can print the sheet out if you want to. You can save it as a PDF. These orders will actually be alerted to the nurses. Okay. So once you have that in there, there's the med reconciliation as well. And then here's your instructions and recommendations. What you have, they need to be admitted to the detox unit. Your diagnosis pulls forward. You can put in here for your billing code. I'm just going to E&M code for me. We do have an auto code feature. For some reason, it's got me on outpatient, but if I was inpatient, of course, it would have me here. There we go. And then if you do physician billing, you can put in the charge there too. All right, so what I'm going to do is I'm just going to go ahead and compile this note. All right. I'm just bypassing some of the pop-ups, which you guys can review that if you want. All right, and then here's my document. And I can scroll through and just review this, see how it looks, if everything is appropriate. Once you get the, do these a few times, you really don't have to scroll through and look at it that much. What I'm going to do is I'm going to go ahead and I'm going to sign this note. And then there's my psych eval. All right, so I'm going to go back to the chart face so you can see some of the other information that was in here. Yes. All right, so it's going to have my details right there. I'm going to see my medication, see my diagnosis here on the left-hand side. If there's any adverse drug reactions, notes and risk factors, that detail will be right there. Now, to get those medications on the MAR, I'm going to go back to the chart room. Okay, so I'm in here as the doctor. I'm actually going to pop this over here. Now I'm in here as a nurse. Okay, so from the nursing perspective, they would have an option here in the chart room where they can see when there's any kind of new orders. This would be yellow if they had those. And they can click on that, and then they can see, oh, these are from the psych hospital. Oh, these are from the psychiatric clinic. Like, they can sort it by site if they wanted to, or they could use all the locations. Now you see right here at the very top, it actually has Tom Jones right there, and I can see who the clinician is and the date and the time that they did these orders. I can click on the little blue arrow there, and it will pop up and it will show me the clinical order pickup sheet so I can review this, and I can actually mark this little box to say I picked this up so I know that I'm the one that did it. So it puts that like signature on the pickup there. You can print this out if you'd like, or go to the patient chart. We're going to click done. I see the medications there. Okay, so now that name has dropped off of this clinical order list, so I can go back to the chart room. All right. Now the MAR is down here in the chart room as well. You can also go to Tom's chart. Because I'm in here as a nurse, it's actually showing me that that the work areas to the notes are pink. That's because those notes don't belong to me. But I can access the MAR from here as well. There is a review MAR button there, or I can review the doctor's note if I need to, and then there's a review MAR button down below. Okay. Now, in most cases, you can just do this from the chart room. So okay, so this is what the MAR looks like for Mr. Jones. I can see there's a blue X there. That's because I have it set in the system that this has to be verified before it can be administered, because you want to make sure the medications are correct. You know, some people are human, they do make mistakes, and we don't want any kind of sentinel event. We want to make sure there's very few medications areas, preferably none. So there's your medication details right there. You can see the detox protocol right there. I'm just going to verify that. Yes. And you can verify each of these. And this is just making sure that you're doing your due diligence. If it's not verified, it'll stay with a red X, and you can, or a blue X, and you can see that the administer button is pink. If you want to administer this medication, I have my protocol set for QAM, means 8 o'clock or 8 a.m. You can set your protocol time frames to whatever you want. Here I'm going to administer, and then I've given it at 9 a.m., just a little after 9, and it has my initials by it. If you wanted to open this up and it requires someone to have a second set of initials to confirm it, you can do that too. They just need to be logged in under their name, and then it has those initials there. If they've refused it, you can click refused, and you can actually put in a comment down below. In my program, it's set so that that comment is required. If they refuse it or skip it, you got to say why. Here, you know, whatever it is that they may be saying why they can't take it, so that you can document that. Most people don't say no that when they're on opiate detox though. So, all right, and then you can click done. All right. There you go. And if you need to administer any of these other medications, you can. All right. Here, I'll give them some Mylanta. All right. And it's just a quick, easy way for you to go in and make sure that they have those details in there. Now, what I'm going to do is I'm going to go back to the chart room. And I want to show you the MAR schedule. So there's a schedule button here in the chart room so that you can see a list of all the people that have been ordered for medications at a specific time. You can sort your MAR schedule by site, like I have it here for the hospital, or you can ignore that location, and just if you're giving it to everybody, whether they're inpatient or outpatient, you can ignore that if you need to. If there have been some new orders and you don't see them on here, and you know there are, you can refresh the MAR schedule. Every time you come in here, it refreshes, but just in case they do it while you're in here, you can refresh that just to confirm. It will show a list of any special orders like stat orders, any PRN orders that require a follow-up, like you have to make sure that everything's resolved or if they took it or how they're feeling. You also have a consolidated schedule of the orders and then the regular orders over here. So these regular orders right now are blank. That's because I haven't selected a time frame that I'm looking for. So these are the list of times that people are specifically scheduled to take their medications. So I can look at 8 a.m. and I can see all the people that need to take their meds at 8 a.m. Okay. And it'll show a list for each medication. So if Karen has 2 meds, it'll show both of her meds there. Now you see down here, Tom Jones, you can see that there's his the medication for his opiate detox. One has already been given, so you know you don't need to give that again. But if I need to give Chapman her Abilify, I can click Mar. There's her details. I got some little notes here. Make sure she doesn't cheek that med and click administer and done. So you can make sure that you're capturing all of these very easily. You can also look for your PRNs and details too if you haven't given those yet. Okay, let's make sure VR Heal gets his honey bun. Now we need to verify that. And there it is. All right, and then hit done. So that's how the MAR works in our system so that you can kind of streamline your process, especially when you want to make sure that you're giving those to the correct patient and also to at the correct time. Okay. All right. Okay, so I'm going to return to the chart room and I'm actually going to go back to my doctor list here. All right, go to Mr. Jones. The last few things that I do want to show you on here are the therapy groups. So that button down here that says therapy groups, that you can click on it. This is where you can actually create the groups, like I was saying before, put people in the group and create a note and push that note to all their charts. Okay, so I have a lot of different sample groups, but let's just say this person, you know, it's I want to sort this by the site that they're assigned to. So here is the psychiatric hospital. These are the different groups that they have. Maybe they have nursing education groups, emotional regulation. Maybe they have about, you know, specific to the chemical dependency. You can put whatever you want in there. Here, there's a little list of different things that you can select. Here's my emotional regulation. You can see all the people that are in this group. Now, if you want to add a new person to the group, you can actually click find. There you go. And there's Tom. Okay. And then you can add that patient to the group. If there's somebody that's no longer in the program, maybe they went to a lower level of care, you can also see that they've been discharged. You can click the little red X and it'll take them out. Okay. If they're absent from the group, like whether they're a doctor or whatnot, don't remove them. Just leave them in there because they'll be in the next one, hopefully. So we're going to click the green plus sign, and here it's going to show the encounter date. That's for today. And here we can just call this, you know, we'll say this is the detox group or CD group, you know, whatever you want to call it. There we go. There's the clinician. If you're not billing for those groups, like if you have a per diem charge that you do, you can exclude that service code. If you're doing fee for service, you can actually put the code in, and that code will be applied to all of those different clients that you create notes for. Okay, so when I do that, it's going to pop over here to the right-hand side, and it's going to show me a list of all the group members. And then these are the notes for their chart. And I'm just going to scroll over. If these people are absent, you can mark them absent, and it won't create a note for them. If you want to create a note for them to say that they're absent, then you would leave that box unchecked. Okay, I'm just going to shorten this list a little bit. Now you have a couple different areas you can do your documentation in. You have your individual remarks where you can put a specific detail about this person if they said something meaningful in the group. Then you have number 4, which is your session remarks. And this is the part that's going to show up in everybody's note. So you can actually click here, Julie Banks, and it brings you up to a shrub. Here you can say the appearance is, you know, friendly, communicative, and relaxed. And participation was active and engaged. She seemed to have good comprehension. Her behavior was attentive, and she talked about self-defeating behavior. Okay. Now, whether you're inpatient or outpatient, we do have like an attendance log that you can generate, where if you want to say here, this person was present, and hey, if you did a UDS on them, you know, was their screen positive or negative? Okay. All right, you can put their status in here if you want to. You can link to the treatment plan for that specific person. For inpatient, I know that you do groups on a regular basis, so you may not have as much time for that. But our program is about saving the time while maintaining the quality content for your documentation, making sure that you're streamlining your processes. Okay, and just click your back button. You can see now that there's a green button underneath Julie's name. That's just to let me know that I put remarks on her, and you can go through and just touch base for most of these. And then here in the section 4 are your group therapy session remarks. And then here you can say like what the therapy type was, what the group was, so on and so forth. This was about relapse prevention. And if there's any other specific details in here that you want to document, you can click there. You can say that here are the interventions you provided. You've facilitated discussion about identifying triggers. Avoiding people's places and things. I mean, just whatever it is that your topics are, you can type in there, or you can create custom buttons for. Here, you encourage exploration, extra related to life, facilitated the group, maybe did some role playing. Okay. And then you can put down here, like whatever your plan is. We're going to continue the groups, maybe change the group, encourage participation, so on and so forth. And then when you're done with this part, you're just going to click the back button. Now that's the part that's going to go in everybody's chart. Okay. So when you're done with your groups and you've done all your individual remarks that you're going to do, you come to step 5, and that's where you can create the notes. You can create the notes, compile them, and sign them, or you can create them and just have them open-ended. Maybe you're not done with them. You just want to go ahead and have that the group did attend. Okay, I like the middle one the best because it just finishes the part out for me. So I can click that green plus sign, put in the start and end time, so I make sure that it's not overlapping. There we go. There's my length of session. This was a 50-minute group, and then I can just click continue. Okay, and it's just going to process those group notes for me. I don't really have to do anything. It's just going to make them. Once the note creation is completed, you'll see a list of those notes over here to the right-hand side, and you can move on to your next group for your documentation. So it doesn't take very long to do group notes in the system. It's very it's a very efficient process to get those in there. If you need to print those out, or if there was a note missing, or if you need to rewrite these or recompile these, you can from here. Okay, and then that's how the group notes work. Now there are other functions, like I said, within the program, so cater more to the outpatient side, or if you want to track, your pre-admission assessments coming in, we do have a calendar. Here in the calendar, it's very easy to make appointments. Basically, you just double click wherever you're going to book the appointment. Here, I have it set to just show my calendar for the week. So I can double click right here at 8 a.m. I can put in Tom's name. There you go. I can put the type of appointment, hey, this is an admission or this is a new patient, and I can put my location because I have various ones. And it's saved. He actually attended, so I'm going to proactively set that. All right, and if you want to put any notes in there, you can just double click on it, open it up. There's the event notes. This was a, admission to inpatient detox. Sorry, my cap's on. There we go, and then click save. If you want to see any other information, you can click on the more. You can print reminders, add multiple people to that appointment, make it recurring. Here you can go to the demographics or look at the insurance. Otherwise, just click save, and then there you go. You can hover over it to see any additional information. If you need to move this appointment, you can drag and drop it, but he did show up, so I'm not going to truly move him. If you wanted to sort this by site, you can actually create groups, okay? And it will sort that out by the different clinicians that are available at that group or that site. Okay. All right, you can access the chart from here. You can go to the patient account. You can look at their appointment history. You can create a note from here if you wanted to. You can print out the schedules if you need to. There's a lot of different capabilities here within the calendar itself. All right, I'm just going to go back to the chart room. And then just tell you a little bit about the billing. We do have our UB04, which you can bill electronically if you have a clearinghouse. It's still in beta right now, but it's about to, it's close to being out of beta. And we also have where you can do your professional billing through here for your physicians. So again, as long as you have an electronic clearinghouse that's integrated with us, that we have the capability to push those out, where you can push those out through a billing report. And our program is note-based, so the note is the basis of most everything in the system. As if you create a note, it generates a claim for the professional billing. If you generate a note, you have proof of that. That's what helped to generates the orders. And we also have like an attendance log so that you can go through and see like, hey, has this person been attending their group? What group do they not attend? You know, again, was their urine drug screen come back okay, or was it positive? So on and so forth. All right, well, that's about all that I have, covering just a nice little broad spectrum of inpatient and outpatient, except for discharging, which is very, very simple, again, in our system. Here, when this person were to be discharged, there is a set button for that discharge date, or if you want to put that in manually, you can do it under the episodes of care in the demographics. If this is the last time that this person is seen and they've been stabilized, now, of course, this opiate detox is not going to be stabilized in one day, but let's just pretend that it was. We're going to go over to the progress note part 2 for the prescriber. And here they can actually stop these meds, or if what they do is if they compile this note as a final exam and create a discharge summary, they have the capability to pull that detail into the discharge summary itself. It will ask them if they want to sign the note electronically, because it's a final exam, and they can go ahead and say yes, or they can say no, and then it'll pop them into the discharge summary part. And the discharge summary actually pulls the information from that very last note that was done. So you can see the interval history, the mental status exam, that was their diagnosis, any medications that they may be discharged on. This person may not be discharged on any medications. They're probably going to go to the next level of care. Here's any discharge instructions. Here I'm going to say refer to lower level of care, condition on discharge was stable, prognosis was, I don't know, I'll say guarded, and disposition, you know, that they're going to the referring physician, or to maybe even to IOP. Yeah, here's the medication list, whatever meds that you're discharging them on, whatever instructions. There's a consent, physical activity, dietary instructions. We have some pop-ups. If you don't want to use our pop-ups, you can just click into the field and type those in. Okay. All right, if there's any referrals, you can attach referrals over to the right-hand side. If there's none and you want to add one right here, you can click that button, click new. This is the name of on the referral. I'm the one referring them. Here I can put in the diagnosis if that's why I want them referred, or you can add medications, or you can make your own buttons. Here I'm going to refer them to actually an internal staff member. So I'm going to say here, and you can have it set in your directory to populate the address, phone number, and the specialty. I don't have anything set with her in particular, but if I did, it would show up there. And then I can click save. I can print this out if I needed to, just so you have a paper copy of it. So it's really nice and clean. Okay. All right, then I'll go back, and that will show on the discharge summary as well. I can print out patient instructions. So if I have any patient instructions in here, that those will show up for them so they know what it is that they need to be doing. Okay, so I can print this out, and it'll show a list of those for them. All right. And then I can move on to my narrative. If I have any specifics that I want to put in here about their course of treatment, you can put that in there. If you want to put any like lab results or whatnot, you can do that there. And then you can move on to your included progress notes. Now, our program does automatically include the psych eval in most cases and that last progress note. So if you have a treatment plan in here, which I didn't cover, but the treatment plans, like most of the program, it has a lot of pre-populated options that you can choose from. You can free text, or you can create your own custom buttons. So if you wanted to include some of this detail in here, you could. I'm going to hit that, compile. And then there's your discharge summary. And again, you have a last minute option. If you want to edit any of these details here in the discharge summary, you can. Otherwise, you can sign it and you're done. And then the only thing left to do with this chart to make it inactive, being that they've been discharged, or to move them to that next level of care. It's just to document that appropriate detail here on the chart itself. Okay, so you can make them inactive here, or you can just move them to the next level of care. It will ask you, do you want to resolve all the diagnosis and medications and details like that? And you can say yes. That way that you don't have to worry about it. Or if you want just the meds to stop, but you don't want the diagnosis to be adjusted, you could do that there too. All right, it will create a nursing note and you can compile, and that's it, discharged. Okay. There are various types of limitations that you can set for this particular type of setting. You can restrict people to certain sites, to only charts that they're assigned to. There's a variety of restrictions and privileges that you can award or restrict for in the security center. So you do have control over certain elements of that. Just basically whenever you're done, like for the day, and this is what we tell all clinicians, is just make sure that you click the pink log off button here to log off the program. If you did get stuck or you have any questions, we do have support and training available. You can contact us. There's a phone number. You can email us, or you can chat with us on our website. Okay, support and training are free and unlimited, so as much as you need, as often as you need it. We also have on our website, we have a support button right there that you can click, where you can check out our knowledge base. We have video tutorials, and we also have training classes. So these are like free webinars that we have pretty much on a daily basis. So some of these are for outpatients. Some may not apply, but other ones like understanding the logs or treatment plans, are pretty relative to any type of level of care. All right. Awesome. Well, thank you so much for your time. I really appreciate it. And just, if you have any other questions, let us know.